We're going to review now some endocrine disorders. First of all, we're going to talk about evaluation of growth. We have discussed some of the growth parameters earlier when we talked about in the actual growth chapter. We're going to discuss some specific entities here also. First of all, the growth chart is indispensable for evaluating growth. The more points you have, the better. So you can see trends, you can see which way they're going through the growth chart, if they're staying on track, or if they're going up or down. The bone age is also a valuable tool. And again, this is done by taking x-rays of the left wrist, that's by convention it's been chosen, and comparing the ossification centers of the wrist with a known standard bone ages. We then take that bone age and compare it to the patient's actual chronologic age and make certain determinations. Growth velocity is also important in the evaluation of growth, and then you can go ahead and evaluate short stature and tall stature. Here is a nice chart that correlates the findings of chronologic age and bone age. We see that if the chronologic age equals the bone age, all right, and the growth velocity is normal, so you're going to plot the growth velocity, and they won't be asking you to know an actual growth velocity, but they may say in the exam that the growth velocity is normal and that the chronologic age is the same as the bone age. That's how they'll present it. So that if the growth velocity is normal and the chronologic age is the same as the bone age, well, that's what we expect. Sometimes you can see a normal growth velocity and a chronologic age equal to the bone age in a patient with short stature. Well, that's most likely familial short stature, and we discussed that and showed you a growth chart earlier. If the growth velocity is abnormal and the chronologic age equals the bone age, then you worry about genetic, chromosomal, and endocrine abnormalities. When the chronologic age is greater than the bone age, so what that means is that the child is, let's say, for example, is 13 years old, and the bone films are that of a 10-year-old, and the growth velocity is normal, then we call that constitutional growth delay. And that is the patient that we've discussed that is a slow or late bloomer and then eventually shoots up and gets into the normal range. The parents are normal height, the child will eventually be of normal height. If the growth velocity is abnormal, then think of chronic systemic disease or any endocrine abnormalities. And lastly, the chronologic age can be less than the bone age. In that case, it's reversed, so that the child is about 10 years old and the bone age is that of a 13-year-old. Sometimes you'll see that with obesity, and then they'll have normal growth velocity. If they have an abnormal growth velocity, think of precocious puberty, for example, or congenital adrenal hyperplasia or hyperthyroidism.